Welcome to the So You Want to Work in Healthcare podcast. I am Leigha, and I have the pleasure of interviewing Chrissy CRNA today. She is a nurse anesthetist. I want to say that again.
It was good.
A nurse anesthetist, as well as co-founder of Confident Care Academy and podcast host herself, and also quite the influencer. So welcome, Chrissy.
Thank you for having me. Nice to meet you guys.
I'm glad we're finally doing this.
Yeah, we're overdue.
Yeah, we really are.
We don't live far away from each other.
No, not at all.
We've been planning this for a while.
Yeah, I'm like right across the river. So the whole point of this podcast is to get down and dirty with the real deal, the scoop on what we do in the healthcare field. I have not had a CRNA yet, so you are the first. I'm really excited. So we want to give our listeners a view of what our careers are really like. So I'm going to start by asking you first why you got into medicine and when you knew you wanted to do the healthcare field.
Oh my God. So it's probably been almost my whole life, which is, I think, not how everybody's life works out. When I was a kid, growing up, my sister had Turner syndrome and autism. So for those of you who aren't familiar with Turner syndrome, it's a very rare condition that you're born with, and only like 40,000 women in the country will ever have it at the same time. It's basically when on the chromosome pair that determines gender, instead of it being XX or XY, it's just X. The second X doesn't cross over. And so you can be prone to lots of different congenital anomalies. And in the case of my sister, as well as many other girls with Turner syndrome, you can have something called coarctation of the aorta. So your aorta, which is the blood vessel that brings blood from the heart to the body, will actually be pinched closed, and that will send you into heart failure if it's a severe enough case. So my whole sister's life, we have, followed up with different doctors, annual visits to the cardiologist to check on her repair, because she had to have heart surgery to fix that in infancy. And then, specialists in the city. We lived on Long Island, so coming into Queens to, see special endocrinologists that specialized in her case, and like all these different types of specialists my whole life. So between that, and I had cousins who were also kind of interested in healthcare. I feel like I watched Rescue 911 and Emergency Vet as like my primary television as a kid, like my whole life.
I forgot about those shows.
And it's so funny because my cousin Jesse, who used to watch it with me, he became a PA.
Oh, cool.
And he works in ortho trauma in Florida.
Nice.
And his little brother Jake, now he's a firefighter in the FDNY. And so it's so funny. We all like kind of end up doing all that stuff. So I thought I wanted to go to medical school. I ended up going down a completely different path because I kind of got talked out of it, honestly, by a lot of people in the field. And there's so many doctors and also my other cousins, a PA, so many people in my life who were just like, oh, there's so many other options in healthcare. You don't have to be a doctor. So I had people influence me to consider PA school. I had an aunt who's a nurse. She tried to talk me into becoming a nurse practitioner. And then I ended up doing a pre-med internship in Mexico, shadowing different doctors. Yeah.
That's fun.
Yeah, it was cool. I had a study abroad experience there when I was an undergrad. And it kind of reassured that I definitely wanted to be in healthcare, but I still wasn't sure how. I did end up going back for a second degree in nursing because I knew it could open like any door. And then when I was working as a nurse's aide in a surgery center, that's when I met CRNAs for the first time and discovered this career. So that's kind of how I ended up where I am.
You are the second person who has had a sister who had a lot of doctor's visits and health issues. And I guess you gain your experience through that, and you either have good experience or bad experiences or both, maybe. I'm seeing a pattern here with people and going into healthcare. And for me, it was probably just my own issues. I was the one in the hospital as a kid, but it's so common. I feel like the story where we have somebody close to us who needs care, and then we have these experiences. So was your experience good with the healthcare professionals?
Extremely positive. Yeah. I think there was just so few people who knew how to take care of her, and we had to go so out of our way to see all these hyper specialized specialists that there were always really good good at what they did, and they all specialize in pediatrics, so they were always so kind to me, the sister, and really got us involved in her care. Like when she would have her annual echoes, like I would watch the ultrasound, and like they would kind of explain to me at an elementary school level what was happening and get me involved. And so it's kind of cute, like being like the little helper assistant when you're a child. And I think that kind of sowed the seed early.
Cool. I love it. You sort of segued into this already, but why CRNA? Like, why didn't you stop at nursing and stay a nurse, or why didn't you choose the nurse practitioner path? Like, what made you like the CRNA path?
Yeah. So that was really hard for me because I think people with imagination can easily become multi-passionate, and I'm definitely one of those people. Like, I think I could have been just as happy as a PA. I think I could have been happy going to medical school. Honestly, I think it's all about finding the right path for you. I think it is unfortunate that people get talked out of it sometimes, because it can be a really tough road being a physician, but it also depends on your own personality and what specialty you go into. And if it's a good fit, it's not going to matter to you.
Exactly.
But I think that it all started out when, again, during my study abroad experience, I actually had some of my rotations fall through. I was supposed to go to 4 different hospitals, and my paperwork didn't work out. The last 2 hospitals at the last minute didn't let me come because of some formality. So the second hospital, the women's hospital in Puebla, there was an anesthesiologist there who felt bad for me and kind of like took me under her wing for the rest of the semester. Nice. So I spent all this extra time in anesthesia, and I was really at first kind of bummed that, like, oh my gosh, I'm going to spend like 3 months in anesthesia. That's going to be so boring watching people sleep. It was so much more than that. Like, I couldn't have been more wrong. First of all, she was an amazing mentor. But second, it's labor and delivery. It's placing epidurals. It's emergency C-sections, planned C-sections, plus, general surgery. And she got me involved with lots of other specialties. But anesthesia was really amazing to me at the time. When I came back to the U.S., I still kept an open mind, like I said. And when I was at that surgery center, there was another anesthesiologist there who also took the time to mentor me. And he helped me make connections with the CRNAs in the facility, and kind of really just give me even further insight into, what their job was like, and encouraged me to spend time in the rooms with them. And then the CRNAs, of course, were happy to have me there. And it was really just exposure, I think, is kind of what got me there. When I became an ICU nurse, I would say that's when it was like the last nail in the coffin, the deal was sealed. I loved being an ICU nurse. I absolutely loved nursing. I thought I was going to hate nursing. I was like, I'm going to do my year and get out.
Yeah, so was the plan always kind of CRNA school, or were you just planning on, because I know a lot of people are nurses, they kind of find themselves in the ICU and then they're like, oh, maybe I'll do this, so what was your...
I'd say I kept an open mind. I knew that every time that I had a new experience, I was pleasantly surprised by liking something I didn't expect to like. Like shadowing in anesthesia for 3 months. I had no idea that would be so interesting to me. So I was like, let me give nursing a real chance, because I could either stay a bedside nurse. I knew you could go into research. I knew I could become a nurse practitioner and still choose a specialty that, was outside of the hospital. Or, maybe I would go back to being a CRNA. So when I got my first job in nursing, I applied to like 100 jobs in 3 different states.
Really?
It was so hard to get a nursing job in 2013. The market was saturated.
Wow. Yeah,
it was like the opposite of what's happening now. You could not get a job as a nurse anywhere unless you went to somewhere like super rural or had a ton of experience. So I happened to have a connection that got me into the ICU at the hospital of the University of Pennsylvania. So it was like a top 10 hospital, cardiac surgery ICU, high volume, high acuity. And I was like, okay, if I do want to do CRNA school, this is going to set me up for it. That worked out perfect. But I'm telling you, I was applying to like med-surg jobs in Harrisburg, Pennsylvania. Like, I would have taken anything. Like, it was bad.
Wait, so then your first job as a nurse was the ICU?
Yeah.
Wow.
I don't recommend it. It was a hard transition. transition. I was not prepared for it. I was not ready. It was tough, but and then at the time I was like, okay, like maybe, I was so anxious all the time, and like nursing was so physically laborious. I was like, maybe I will just be here for a short time and then bounce and go to CRNA school. But then once I got comfortable, I really fell in love with it. I really enjoyed bedside nursing. I was like, I don't know what's going to happen next.
Yeah.
But I did start to realize that, I remember that anesthesia was all of the things that I love about bedside nursing, but none of the things I didn't like. You get to one patient at a time.
Yeah.
You get to give them your full attention. You don't have to be pulled away by, a manager in the middle of patient care, or, deal with unit drama, like any of those things. You're really just focusing on the person in front of you, which I love.
Cool.
So for me, it was kind of an obvious next step.
Yeah. How long were you in bedside nursing or in the ICU?
So I started applying at the 18-month mark because all the schools in the Philadelphia area, I was living in Philly at the time, they all had 2.5 to 3 year wait lists before you could actually start.
Oh, wow.
Yeah. So I was like, okay, I'll be a nurse for 4, 5 years, depending on the program.
That's a long wait list.
Yeah.
Wow.
You got to plan way ahead if you're a Philly nurse. Absolutely. Unless you're willing to leave the area.
Yeah.
But even then, most schools, it's a 1 to 2 year timeline before you start the program, when you start applying and thinking about it. That was my plan. I was like, okay, I'll be here for 3 to 5 years at least. And I threw in an application at the last minute to UPenn because it was supposed to be the last year of their master's cohort. After that, all the CRNA programs were moving to a doctorate.
Okay.
So it'd be an extra year of schooling, more money, more time. So let me just throw this application in. Well, they called me 4 weeks later and they asked me if I could come down and interview. So I had 3 days to prepare for my interview. Did well in the interview. They called me 2 days later and asked me to start the next month. There was there was a dropout spot on the wait list.
Oh my God.
They're like, they're like, do you want to start for the cohort that you were applying for, or do you want to start now? This is going to be our last year of the master's. Next year is going to be our doctorate program. So if you start in 2016, you're going to have to do the doctorate. Right. So I took the opportunity and I started with 20 months of nursing experience, which I also don't recommend because I definitely got my ass kicked in CRNA school.
Yeah. I can imagine. I mean, it just all seems so complicated. And just listening to a couple of your podcast episodes, the way you guys speak about medications and things like that, I'm like, way over my head. I only know how to fix bones. And but no, for real, it's serious. It's you're in charge of the patient's life. So I understand why it's so intense, but it must have been hard. I really commend you for doing it that fast, but like you said, you don't recommend it.
If I could go back in time, I think I would have actually waited the extra year.
Really?
And I think
done the doctorate?
And done the doctorate, or possibly even just, continued with looking at the other programs in the area. Yeah. I loved my alma mater. I loved UPenn. It was an amazing experience. I can't say a single bad thing about it, but I think 1 more year in the ICU would have really helped me have a smoother transition. I felt like I had to work. You always have to work hard in CRNA school, but I felt like I had to work extra hard to catch up on the collection of experiences that I had missed out on, because most of my peers had 5 years of nursing experience. That was the average amount of experience in my cohort, and that's pretty normal for most CRNA programs, 3 to 5 years.
Right. See, these are the things that our viewers and listeners need to know.
Get your experience.
Get your experience first.
Plan early.
It sounds like it, very early. What do you think is the difference between a doctorate and a master's program? Do you think there's a big difference?
They're all doctorates now.
Okay, so it's kind of like in PAs used to just be, I think it was just a bachelor's degree at first.
Was one of the last bachelor's cohorts.
Yeah, and then now we all have to be master's degrees, but okay, so they're all doctorates now. Do you see any difference there in the curriculum or?
So for the core anesthesia curriculum, no. It's the same exact core anesthesiology courses, the same science, everything, even the same number of clinical hours and case numbers, all the same. The doctorate of nursing practice is supposed to integrate really more of a research component
Okay.
to kind of help elevate the profession to be more involved in research and quality improvement, and especially like a focus on translational research. So there's a lot of lab research that exists in the world already. And of course, there are nurses and CRNAs who also participate in that. Do you know CRNA Scientist? Have you followed her?
No, I don't think so.
She's really cool. She actually does like lab research. She's like developing drugs. Like it's amazing.
Wow.
But taking that research that we already know, like all these theories, and then bringing it to bedside practice and changing the way we actually do things is called translational research. So that's kind of the focus of the doctorate. It adds in different courses. It's supposed to prepare you to do that.
So you have your master's then?
I have my master's.
Let's talk about the application process. What do you need to go to CRNA school? Again, you've already kind of mentioned some of it, but if you can just tell, let's say there's a nursing student or a current nurse who's interested, what would you tell them they need?
So first, you need your Bachelor of Science in Nursing. So if you've already started out with like an associate's degree from a community college program, that's fine, but you need to finish your bachelor's before you start your application. You also, about half of programs will want you to take the GRE. Sometimes they only need you to take it if your GPA is below a certain cutoff, and sometimes they want it for every student. You'll definitely need ICU experience. The majority of programs require a minimum of 2 years of ICU experience before you apply. The technical rule, according to the Council on Accreditation, they have a rule that at least 1 year of ICU experience is needed. So sometimes exceptional candidates can get in with a year, especially if you already had experience doing something else. Like some people were like ER nurses, or they were like a paramedic and then they went back to nursing school, so they had a little less ICU time. So people like that, or really strong GPAs, Division I athletes, people who like have a long history of high performance can sometimes get in with just a year.
Okay. I like that though. I like that they want a year at least.
Has to be a year.
It makes sense. You said you would not recommend going straight to the ICU, right? As a nurse, do you have any like advice on what they should do first?
I guess that's a hard thing to say because it really depends. There's definitely cases where I think people can absolutely thrive as new graduate nurses in the ICU. And I think if the ICU has a long enough orientation and a supportive culture, it's completely possible. Nurses do it every day. And I think a new grad can thrive anywhere. Anybody can learn anything if there's enough time and enough resources and support. The problem is that nursing school doesn't really prepare us for the demands and responsibilities associated with ICU nursing. So if you are going to go to the ICU, make sure you get either a nurse's aide job or a nurse externship or a senior year clinical preceptorship in an ICU. So you're getting ICU exposure and some education before you get there. You don't want it to be your first time touching an arterial line when you start your ICU job, like me. That was hard.
What would you say is the cost of nursing school, CRNA school together separately? Let's talk money, because healthcare is so expensive to go into in many cases, but I think that there are ways around it, student loans and things like that. I know about that well. I don't know if you took loans, but I was a slave to my loans for many years. But yeah, so let's talk cost. How much was nursing school? How much was CRNA school? And when it's all said and done?
Yeah, well, there's such a range with nursing schools. So if you are one of the smart people, not like me, who goes to an associate's degree in nursing program at a community college, it can be extremely affordable. You can get your associate's degree in like a 2 to 3 year nursing program, again, at a local community college for, I think, Hunter College. It's a Bachelor of Science in Nursing in New York City. It's a City University of New York College, a CUNY school. If you're a New York State resident, it's like less than $1,000 a credit.
That's great.
So it's really like, so you can keep your loans. I'd say under 30 grand easily. The CUNY schools are all pretty affordable, but a state school, a local school, anything that you can start out with your associates, you can get into the workforce sooner, and then you can finish your bachelor's degree online and have your job pay for it. Almost every hospital will pay for you to finish your bachelor's degree.
Really?
So that is a great way to save costs and not do it the way I did it. My second degree was nursing, so mine was like a $40,000 program at Thomas Jefferson University in 2012.
Okay.
Because it was a second degree accelerated BSN. So I already had 40 grand of undergraduate debt, 40 grand of nursing school debt. And now I'm like a new grad nurse making $27 an hour and $80,000 in debt in 2013. That was tough. CRNA school is very expensive. That's no secret. But there are, again, a range of costs of programs. So there's some cheaper schools in Tennessee and Arkansas, for example, that can cost less than $60,000 for the entire program.
Oh, wow.
Yeah, not too bad considering it's going to triple your salary as a nurse.
Right.
And, you know, at the higher end, some programs can cost over $250,000 for the whole thing, which is more comparable to the cost of medical school.
Yeah, that is.
That being said, it's a cost of medical school.
Yeah.
One thing I like to tell people, though, it's a profession that will give you a return on investment. Yeah. So I think most people can expect a CRNA program to cost around $150,000. I think most of them are in that range. And then again, nursing school, if you go to a state school or community college, you can definitely keep that cost low.
So smart.
I would do it.
Yeah, I was dumb about it too. I transferred from a school undergrad that was like $20,000 a year to Fordham in the Bronx, which was almost $50,000 a year. So that was cool. Real good choice. No, but I loved it. And you know, who knows? I might not be where I am now if I didn't go to Fordham. It's expensive, but don't let it deter you, I'd say. I think there's ways around it. And also loan forgiveness, it exists, it works, it's not a scam. I am one of these people to be forgiven. Have you been forgiven?
I'm 22 months away from getting my loan forgiveness.
Yay.
So that's the thing, right? Like, you, as a nurse, what does the average nurse in the U.S. make? I think in the South, the average is like around $60,000 a year. In New York City, it's more like $110,000 a year. Wow. So the average for across the country is probably like $75,000 to $80,000 a year, something like that. California nurses in the Bay Area, they're loaded. They're making more money than all of us.
Same with PAs in California. I'm like,
strong unions. Everyone needs to unionize.
We took an intermission.
You know, one thing I did want to bring up though was like salary transparency. Because I think nobody knows how much anybody makes.
I know.
And you Google things and then you're like, that's a huge range. Mm-hmm. What does that mean?
Right.
And then how do you know if it's worth taking the risk of student loans? We're also debt averse, those of us who grew up without, parents paying for college. Right. Like, of course you should be debt averse, but sometimes you have to make that investment in yourself in order to have this type of career. Otherwise, I don't know where I would be. For CRNAs, you can expect that your starting salary will be at least $150,000 if you graduate CRNA school as a new grad, W-2 employment, meaning you're working for a group or a hospital. In New York City, it's significantly higher, which makes sense. Our cost of living is crazy. You're going to make closer to like $245 starting, I think is what most of the hospitals in the area are paying right now.
That's a big difference.
Big difference. Yeah, like think like Atlanta, Florida, like 150 is like a good estimate. Maybe Texas even, but New York City 245. Philadelphia is probably about 200. I have some friends in California in the Bay Area who are making quite a bit as well. Now they have some experience, but they're making closer to $300,000 a year.
It's funny you say the cost of living difference in New York is significantly different. As a PA, I felt as though our salaries were not that different. When I first started, 12 years ago almost, my friends in Michigan were making the same amount as me. And I had a problem with that, but I couldn't do much about it. I do think it's changing a little bit now. Like New York is catching up. But what I was saying before was I've been seeing salaries in California that are significantly higher than even our salaries here in New York. And I'm like, okay, we need to catch up because it's the same cost of living, if not more. I'm pretty sure in New York, at least, there's a law that you can't stop people from talking about their salary. You can't fire people for talking about it.
Pretty sure that's true too.
Yeah. So know your worth. Go in there, either find a new job or talk to your boss or whatever it is, and we need to hold ourselves to higher standards in some situations, I think.
Absolutely.
So yeah. But that's a good salary. That's a good starting salary. I'm not surprised just because I did some research, but also like the 300,000 kind of range. It's nice. It's a different kind of lifestyle.
And part of the reason for it is because a few years ago the statistic came out, so it's different now. But when I was in my training almost 7 10 years ago, 50% of anesthesia providers, so CRNAs and physicians, were over the age of 50. So a lot of our workforce is retiring soon, going part-time, things like that. After the COVID-19 pandemic, of course, we had a big shift where a lot of people quit their full-time jobs that were close to home. They didn't feel valued by their hospital or their group anymore. They were burned out, and they took up 1099 work, meaning you are an independent contractor, you're your own boss, and you directly contract out your labor to places that have needs. You can get paid double your hourly rate easily, and people are saying, okay, I'll just buy my own benefits. Why should I be loyal to one home? So between the 1099 shift and a large portion of our workforce leaving constantly, we really can't keep up with the demand for anesthesia professionals, especially because the biggest way that hospitals make money is with surgical services. So as our population ages and needs more surgeries because they have complex medical needs, and as hospitals start to churn out more and more and more procedures with anesthesia services, and as we lose our workforce, the salaries are increasing quite rapidly. When I graduated, we had the same issue in New York City, where New York was unaffordable for CRNAs to live. The starting salary was $120 a year in Manhattan. In Philadelphia, was starting at $165. So it was making more money in a place that had a 40% cheaper cost of living.
It made no sense.
It was completely unfair. But New York City essentially had a brain drain. They couldn't hire enough people, and the employers had to catch up and had to change things, especially after COVID-19. So that is why salary transparency is so important. You do need to know your worth. You do need to network with peers and talk about it and pass on that information, because if we don't demand it, no one's going to give it to you.
Exactly.
And it's not about greed, but it is about, you put in the time and the labor and the education, and you're taking on liability. You're taking care of very sick people, and you deserve to be compensated for your services.
And just to lay out, I guess, real quick about a PA salary, it's really just about cost of living. Like when I first started, my 2 paychecks, one paycheck paid my rent, the other paid my loans, and I had like $500 left over. And that's it.
That's how it was for me as a nurse. It was horrible. And even as a new grad CRNA, I obviously have high student loan payments. It was quite similar for a little bit there.
Actually, there's something I don't know. There's nurse anesthetist and there's an anesthesiologist. And obviously you work in the same kind of realm. But PAs, we have to work with a supervising physician. Not in every single state anymore, that's changing. But is it the same for you? Do you need a supervising anesthesiologist? Can you be your own contractor?
This is the hardest question to answer. So by law, technically, no. Technically, no. Your legal authority to give anesthesia actually comes from your nursing license and by passing your board's exam, the NBCRNA. That being said, the Center for Medicare and Medicaid Services has created a rule, because medicine is political and whatever, we're not going to go there. But, the political landscape is such that the Center for Medicare and Medicaid Services has required, in order to get reimbursed for your services, physician supervision. Now, it doesn't clarify what type of physician that needs to be. So your supervising physician could be an anesthesiologist. It could also be the surgeon you're working with. So even today, here in New York City, I could have a conversation with a plastic surgeon and say, do you need anesthesia services for your breast surgery patients? And they'll say to me, sure. And I could work with them. No anesthesiologist in the building, just me and the surgeon, and they're technically my supervisor, even though they don't know anything about anesthesia. So that's how it works in most states. That being said, there's another clause, another layer to this, called opt-out. So actually about 22 states in the country now, I have to be fact-checked on this, I think we're up to 22 states now that have opted out of this clause. So the governor of a state can decide to opt out of the CMS supervision clause and say, you know what, in my state, we need all the anesthesia help we can get. We're not going to set up these extra barriers. And if you guys want to be reimbursed without any supervising physicians, come on down. So 22 states have opted out of that. And it's basically an incentive for hospitals and groups to feel more comfortable contracting CRNAs without requiring an anesthesiologist to supervise, because it can be really hard to hire anesthesiologists.
This is the ongoing argument, right? Like, we don't have to get into it, but it's a hard topic because there are so many areas in this country that have a lack of physicians, or in your case, anesthesiologists, and they need people like CRNAs and PAs to provide care. But at the same time, NPs, PAs, CRNAs, I could see how the physicians feel like it's an encroachment on their profession. So like, I can see both sides, and it's such a hard argument. Like, when people ask me this question, I don't have an easy answer. The question of, should PAs, in my case, have full practice authority? Like, I don't have an easy answer for you, because it's so different. I feel like in every specialty, subspecialty, I think it depends on, for me, how much experience you have. Like, I am not against it, but under the right circumstances, in the right situations, at least for PAs. But I know that there's a lot going on this subject, and it's so hard because people just want to like attack, but it's like, wait, we have to keep the patients in mind here. Like, the patients are the people who are going to benefit, and as long as we do it right, have the right checks and balances, I think it's okay, but it's a hard argument.
Yeah, the line that I take from it is, I think it's very naive and disingenuous to believe that the learning stops on the day of graduation, right? Yeah. Like, you can argue about training hours and all of these things, but we all have to have continuing education, and we all, once we have a certain amount of experience in the field, the knowledge gap gets smaller and smaller and smaller as time goes on, right? And there's really no measurable way to prove that on a piece of paper. We don't have any way to measure one person's ability against another once you're out in the field. I wish that we could invent some sort of a system where, and actually I think this is what they've done for some nurse practitioner laws in certain states, but I wish we could invent some sort of a system for the different professions where, like, after X amount of time of experience, you could take the same exact boards exam as like the physician's like specialties.
This is what I say.
That you want to work in, and like, and if you can pass the same boards that they do, and you've had X number of hours under your belt, like you have the same number of experience hours, then that would be the solution.
Totally agree. And
I don't think anybody would be mad about that.
No, I don't think so. I mean, it's what's fair, in my opinion, and it's the same thing I say. Like, I made a video on social media, and this was like a year or two ago, and it got interpreted. I didn't even say what my opinion was, and it got interpreted in the most negative way. I got dragged through these Facebook groups, like, by people I've never met before. Like, it was bad. I had people yelling at me in my DMs. I'm like, what is going on? But to clear the air on this situation, I agree. I think that I am not totally against it for PAs, but why not take the same exam that the physician takes? And if you can prove that you can pass the boards, like if I can pass the orthopedic boards, I have over 11 years experience in orthopedics. I feel comfortable in my subspecialty. I feel like I should be able to treat patients on my own if I can do all that. But I don't push for that because I'm just like happy where I am. I like working with physicians. Like if you want to do it, go for it. But yeah, there needs to be like the right laws in place, I think.
Yeah, because I think the people who have a lot of experience and are very strong clinically, I understand them feeling like, hey, I should be able to practice independently, right? And I think for CRNAs, we have a long history of practicing independently. The profession kind of developed that way, so I feel like it's a little bit of a different situation, like from a legal perspective. However, talking about like CRNAs, MPs, PAs, like if we put us all into a bucket, I think that we also have to, like you said, protect patients. And okay, this is where I can give the best example, and it's okay if the MPs come for me because we're friends. We're all nurses, right? The sad reality is that nurse practitioner schools are not as tightly regulated as PA schools and CRNA schools are, and it's very unfortunate because I think that we all benefit from more education and more time in the field. And I know so many NPs in real life who are amazing, phenomenal. Like, brilliant. I mean, absolutely mind-blowing. But these programs do exist that are primarily online, where people get the minimum number of clinical hours. It's only like 500 hours in a certain specialty. And then that puts us in a hard position where how can we advocate for, you know, PAs and NPs to have full practice authority when there are people who have minimal nursing experience? You know, it's not like they've been a nurse for 20 years, they've been a nurse for a year or maybe 0 years. And then, you know, and then they do 500 clinical hours in family practice. And should they be taking care of patients solo? I don't think so. So, you know, the safety mechanism would be X number of hours in the field, passing a board's exam to get everybody on the same page. Not that I don't believe that a nurse practitioner with tons of experience and who did more clinical training could absolutely do it.
Right.
It's just that how do we provide that check and balance system-wide?
Exactly.
Right? Because like there's amazing people who are fully capable. You know, I believe many PAs are fully capable. I believe CRNAs are fully capable. We, you know, have a very different training than the NP group does. Like it's more tightly regulated. But still, I think that if people want to argue about, hey, I've had more hours of training, like, okay, well, how about when we hit the same number of hours and we take the same exam, then we'll all be on the same page.
That's the answer, in my opinion. Moving on, my 2 favorite questions to ask. What do you love most about being a CRNA, and what do you not love about it?
So what I love most is kind of what I said earlier. I love the one-on-one patient care. I love that I'm not pulled in a lot of different directions. I only have to focus on the person in front of me. So if everything gets out of control, if the patient codes, if they're bleeding to death, like I only have to think about you.
Right.
And I can pull all of my resources together. I can call on help and I can give it my all to take really great care of that person. And that's so rewarding to me. I hated being pulled in multiple directions. My least favorite part is probably the politics. I wish that somebody had warned me about it before going back to CRNA school, that, you know, it does sometimes feel like an uphill battle. I do feel like I have to be really cautious about the language I use. I feel like I have to be cautious about the opinions I speak about on the internet, when really at the end of the day, I just want to take good care of people and, you know, do my best to study and continue my own education and be an excellent provider. That's really all I want. I'm happy to work with anesthesiologists, big fan of anesthesiologists. I just hate that we have all the politics in the profession. That is like,
it's tough.
It's so hard.
It is hard. I think the majority of us just want to do well for our patients. Yeah. Let's talk a little bit about your entrepreneurial endeavors. So I'd like you to talk a little bit about Confident Care Academy, because I'm totally into it. I mean, I listened to one of the episodes today and I was like really interested, because I'm like, ooh, I feel like I'm getting smarter. But yeah, tell us about how it started and your business partner and how it's going.
Love the segue, love the intro, thank you. So Confident Care Academy is really a passion project. Back when I was a new grad ICU nurse, I felt like I drowned. Yeah. There were no resources out there. All the resources on the internet are very patient-facing, meaning they're extremely basic, just giving you the brief bird's eye view of what's going on, or they're very physician-facing, like up-to-date, giving you all like the research studies, and none of it really is application-based for nurses at the bedside. And if it is, it's usually too superficial and definitely not specialized enough for critical care. I think there's like one critical care textbook for nurses. There's like this one for cardiac surgery, ICU nursing, that again, like didn't really answer any of my deep questions. There's the ICU book by Paul Marino out there that I always recommend to nurses, but it's really meant for physicians also. And that's really it. That's all we got. So when I was sitting in my classes in CRNA school, every single day that I would sit in Dr. Libinati's pathophysiology class, I feel like all these light bulb moments went off and I was like, oh my God, if I had only known this last year, I could have taken such better care of my patient. And I felt so frustrated that I'd ask questions all the time. And you either hear from fellow nurses like, oh, we don't need to know that. Or you hear from providers, oh, you don't need to know that. Or you're like digging through the internet and you're like, I don't know, I've been in a rabbit hole for 4 days and no one will explain this to me. Yeah. So, you know, those daily light bulb moments just became like the fuel to my fire. I was like, that's it. When I get out of here, like I'm going to make something for the nurses. I don't know what I'm doing. I'm going to make them something, because I don't want anyone to be in the position that I was, like new grad, drowning, stressed. If we take better care of our care providers, we're going to take better care of our communities, right? It's going to trickle down to better patient care. If the nurses get the knowledge that they deserve to have access to. So Confident Care Academy became an online lecture library. I decided to team up with Anna Job, Anna SRNA on socials, because I needed someone who was still a bedside nurse who shared the same vision as me.
Yeah.
So now she's actually in CRNA school too.
Yeah. I've been like loving watching her journey in that. It's been great.
I feel like she's like my little sister going through CRNA school, and she calls me at the end of her clinical day and I'm like, good job. It's like, give her a little pep talk.
It's cool because you have the experience and she's in school, so it's like you can stay current and then also have all of this experience.
It's really the best of both worlds, like coming at it from both sides, because she's been a bedside nurse more recently than me, and you know, there's some things that have changed. Like a lot of things are more bundled and protocolized now nationwide, and you know, I'm familiar with what we do in the OR, but I don't always know like, oh, you guys like have that bundle now? I didn't know they finally rolled it out. We talked about it a decade ago. I didn't know they finally got around to it. So we have that really nice balance. But so we have this online lecture library where we bring in-depth graduate level pathophysiology, pharmacology videos for nurses. It's meant to bridge the gaps between nursing school and critical care nursing. And if you're already a critical care nurse, it also helps prepare you for CRNA school, because you're going way deeper than, you know, what nursing school provides. So a lot of our members are kind of on that pathway where they're interested in CRNA school or applying. And we just had a ton of people get in. We had 6 of our members got into the same exact cohort of the same exact class this year at UPenn.
Wow.
I know. I did not know they were applying. They all told me on the same day that they all got into the same class. I was like,
that's amazing.
Crazy. Yeah.
Oh, you're doing such good things.
A 7th one on the wait list.
Really?
So it's going to be, if he gets in, a third of their class is going to be CCA members.
Oh my God.
Isn't that really cool?
That's really cool. Doing big things. I love it. And I like that you're kind of like taking care of your nurses. It's really nice.
They're my people. You know, I feel like nursing really is our foundation. And a lot of people, once they become CRNAs, I feel like kind of want to almost like abandon the nursing background. Like, oh, I'm not a nurse anymore. But really we are. That's our foundation. That's how we like learned our hospital skills, our people skills. Like,
don't forget where you came from.
It's the philosophy of care, you know, like anesthesia is the nursiest job I ever had.
Really?
It's so nursey.
Is it?
Like when I was a nurse, I feel like I was constantly like calling PT, calling dietary, like on the phone with the family, running around, like going to supply closets. In anesthesia, my eyeballs are on the patient. Like my job is like constant monitoring, fluffing, tucking, assessing. Like what is nursier than that?
Next question, one of my last questions. Is there anything you would do differently in your course to becoming a CRNA?
Yes.
I mean, you already talked about your, like, you wish you had more experience, but anything else, or do you want to elaborate on that?
I think the first thing that I would really do if I could do it all over again, like back it up to 18 years old, is I wouldn't have let people talk me out of anything. Okay. Because I think that, you know, originally I wanted to go to medical school, and I really loved that anesthesiologist in Mexico. And I think if I had gone down that pathway, I would have been equally as happy. So I think what I ended up doing was I took the zigzag path, and it took me about the same amount of time, maybe a little less time, but still quite a bit of time, and the same amount of debt. And I ended up doing a very similar job, but, you know, with some political limitations that I didn't really expect. And I didn't really need to take this pathway to get here, right? Like I kind of stumbled my way into CRNA. I'm happy. I love being a CRNA, but it would have been a lot more straightforward if I just stuck with plan A. Maybe a little less dramatic, you know what I mean? Yeah. But at the same time, I think had I chosen to be a CRNA from the beginning, or like knew about it in high school, I think I could have easily chosen this path too. Right. Like I think if like someone came to my high school who was a CRNA on career day and told me about this, I still could have easily chosen it, because I really do love it. I think it's a pretty great gig. I highly recommend it as a profession. And I would have, the only thing else I would have changed was spending more time in nursing. That's really it. If I could have had like a full 3 to 5 years in the ICU, I think that would have just made my transition into CRNA school easier, and just help me put the pieces together a little bit smoother. You know, you really don't know what you don't know at the time. Yeah. You can have a lot of clinical knowledge. I've always been very smart. I've always been a hard worker. I've always studied a lot, but that experience component is so priceless.
Right. It is. Yeah. You can't really get it anywhere else. It comes from experience. There's so much to say about that. What can we tell our listeners and viewers who are thinking about going to CRNA school, or even not even there yet, just thinking about becoming a nurse? What is the biggest piece of advice you could give to, a high school student, maybe a college student, a current nurse, someone wanting to become a nurse anesthetist?
Well, I think there's a lot of naysayers out there. So the biggest thing is to, again, don't let people talk you out of it.
Yeah.
There are so many people who say, oh, it's so expensive, or oh, it's so hard to get into. And it is, but you can do things to make yourself stand out. You get that high acuity ICU experience. You take extra courses to boost your GPA. You get some research experience. You attend meetings and network with CRNAs and, shadow extra. All of these things will help you stand out. So you can absolutely do it. You can absolutely get in. And yeah, it's expensive, but there's loan forgiveness out there. There's ways to make more money. And at the end of the day, I think we both have rewarding careers, and the money works out in the end. It really just does.
I agree. I think sometimes you just have to be scrappy, and I have a lot of people DM me, oh, I can't get shadowing hours, or it's so hard and this and that. How did you do it? How did you do it? How did I do it? I literally showed up in person and asked if I could shadow doctors. That's how I did it.
You have to beg. Yeah.
Yeah. There's ways to do it. There's ways around, your little roadblocks. And yeah, I agree. Don't let people talk you out of it. My most commonly asked question is definitely why PA versus MD, or why didn't you go to med school? And it's hard. I tell them, if you're passionate about being a physician, go to med school. At least try. Take the MCAT and do it. I, at that point in my life, was no longer passionate about it, I guess, enough. But it's so funny, I'm saying passionate, but I just watched your podcast where you were like, if I hear the word passion one more time, shit. But you can be passionate about helping people and
Just don't put it in your essay, or else they'll throw it out the window. I think, the easiest way for me to help people troubleshoot down this pathway is to picture the actual job you want to do every day, right?
Yeah.
Okay, so, if it's doctor versus PA, or versus CRNA, these are very vague, elusive concepts.
Right.
And being a doctor can look like 1,000 different jobs, right? Do you want to be an ophthalmologist? Okay, then go to med school and become an ophthalmologist, right? Do you want to have a job where you have hours that you can clock in and clock out? You're not committed to, the needs of the department and call and these elusive, vague things that a group always needs. Do you want total control of your schedule, total work-life balance? Yeah, then you should think about being a CRNA or PA school, because you can really have hard boundaries on your hours. Whereas if you don't care about that as much, or no, I don't mind committing to the needs of the department, and I just want to be faculty and do research, and just this is my passion, this is what I love, then yeah, go to med school. So it really is about that lifestyle and how strongly you feel about the actual thing you'll show up doing every day.
Totally. Yeah. Is there anything else you want to talk about or say?
Don't
to
drag
wrap
me
up?
through Reddit.
Don't drag her through Reddit. This has been really good, really great. I learned so much already just sitting here talking to you for the last hour, and I'm stoked on CRNA school. So if you guys are interested in becoming a CRNA or an ICU nurse, definitely check out Chrissy and Anna's Confident Care Academy. It looks awesome. And where can they find you on social media?
So you can find me at Chrissy CRNA, CHRISSY CRNA, on all platforms. And then if you are interested in having more of that clinical education and life advice along the way, definitely check out Confident Care Academy. That's on every platform also.
Well, this has been awesome. Thank you for watching. Thank you for listening. If you're watching on YouTube, don't forget to subscribe and comment, all that good stuff. And this also will be available on all listening platforms. So check it out. This was a great show. Thanks.
This is the So You Want to Work in Healthcare podcast with new episodes every month. Don't forget to subscribe to stay up to date on the latest releases.